Hello, today we've got Milton Chen, the co-CEO and founder of VSee Health, trading on the Nasdaq under the ticker VSEE. Milton, welcome to the show.
Thank you so much.
You came up with the idea for VSee while completing your doctorate at Stanford. Could you share with us what inspired you to build a telehealth company and how that whole journey started?
Hey, thank you so much for the question. I mean, telehealth is pretty exciting, right? The impact on people's lives in there. If you look across the industry, right, telehealth tend to be just the software is not that good in there, right? They tend to be really difficult to customize. It's not very secure. It's very hard to scale. So what I want to do is I want to create something really easy. We're just like making high quality software for the whole industry that's secure, really scalable and robust, and really easy to customize to whatever the clinician experience wants to be in.
VSee has been the telemedicine provider for the NASA space station for more than a decade. Share with us, please, the story behind that collaboration. And I really want to know, what are the unique challenges and innovations that you have to face when creating a telemedicine system for space?
Yeah, I think the number one challenge, you gotta be super secure, right? You probably know that when you connect to NASA space station, there's a lot of potential attack vector from foreign, adversaries and so on. And the second thing has to be super easy to use in there. So we were very fortunate when NASA did a benchmark on VC compared to everything else, and they picked VC as the easiest to use and the super secure and robust system.
Now, Milton, one of the biggest shifts you've introduced is empowering clinicians to create telehealth and AI software without writing any code. It's similar to building a website without knowing any programming. How do you see this democratization of technology impacting the healthcare industry?
Yeah, we're super excited. So if you think about, for example, like all these physicians and nurses, they have all these great idea, right? What would make their workflow really high impact and so on. But often they're struggling, like waiting for the IT, the software people to come in to do what they want to do. Now you can shorten this, right? Just like today, anyone could create a beautiful functional web page without knowing any programming or IT skill, right? We bring that same thing to every physician, every nurse, right? You have a great idea, no program requirement. Just use VC Lego like building block, shuffle them together, and that's exactly what you need to take care of the patients.
Your platform integrates seamlessly with major electronic medical record systems such as Epic and Cerner. Why is this integration important for healthcare providers and, of course, patients too?
Yeah, I mean, the way you think about it is right. Your health is not just connected to one physician, one hospital. It's a set of bridges to all the different healthcare entities, and they need to understand you, share the data back and forth, right? So that means when the physician has the complete picture of who you are medical wise to all the different places, they can make better clinical decisions. So that's what VC does. We link interface with all the major EMRs so that your information can flow back and forth. And again, at the end of the day, physicians and nurses make better clinical decisions and better take care of you.
Turning back to security for a moment, Milton, how do you create that security fortress to keep your clients' data safe? And I'm asking this, of course, with the background being the recent rise in healthcare data breaches.
Yeah, thanks for that question. So to me, right, for example, in the last year, just this year so far, right, between a third to a half of Americans' patients' health record has been stolen. To me, that just really unconscionable, right? How could this much massive thing? The, the problem is the way traditional software are made is you have this create this monster-sized software, you write it, and there's all these attack vector in there, right? It's really difficult to write code that has just secure using that traditional way. The VC approach is we create a set of individual Lego-like building block. Each building block is hardened. And now you can take the individual hardened building block, stuff them together, create your overall system. And because the individual pieces are hardened security-wise, when you piece them together, they maintain the same security model. This is how we can make a security fortress to keep everything to the extreme level of security.
And finally, Milton, for those investors out there tuning in, why is now a great time to be part of VSee's journey? And what makes VSee a compelling investment in today's healthcare technology landscape?
Yeah, I would say if I could zoom back out just a little bit, right? So healthcare is the last industry has not been digitized, right? If you think about how you buy stuff on Amazon, entertainment on Netflix, right? Over again, your banking. So everything has been digitized, but not healthcare yet. So we are creating the foundation, the building block to allow every hospital, every insurance company, every doctor office to go digital. Again, we're pretty excited. I think if you fast forward a couple of years, you can look back at this moment in time and say, that's that moment, right? When the entire healthcare industry has been digitized. And this is the perfect time to join the journey and let us ride with you.
It's a great story, Milton. Thank you for telling it.
Oh, thank you so much.